Iron deficiency. Anemia. Iron is very important in maintaining many body functions, including the production of hemoglobin, the molecule in your blood that carries oxygen. Iron is also necessary to maintain healthy cells, skin, hair, and nails. Iron from the food you eat is absorbed into the body by the cells that line the gastrointestinal tract. The body only absorbs a small fraction of the iron you ingest. The iron is then released into the bloodstream, where a protein called transferrin attaches to it and delivers the iron to the liver. Iron is stored in the liver as ferritin and released as needed to make new red blood cells in the bone marrow. When red blood cells are no longer able to function, after about 120 days in circulation, they are reabsorbed by the spleen. Iron from these old cells can also be recycled by the body. Am I at risk? Iron deficiency is very common, especially among women and in people who have a diet that is low in iron. The following groups of people are at highest risk for iron deficiency anemia. Women who menstruate, particularly if menstrual periods are heavy. Women who are pregnant or breastfeeding, or those who have recently given birth. People who have undergone major surgery or physical trauma. People with gastrointestinal diseases such as celiac disease, sprue. Inflammatory bowel diseases such as ulcerative colitis or Crohn's disease. People with peptic ulcer disease. People who have undergone bariatric procedures, especially gastric bypass operations. Vegetarians, vegans, and other people whose diets do not include iron-rich foods. Iron from vegetables, even those that are iron-rich, is not absorbed as well as iron from meat, poultry, and fish. Children who drink more than 16 to 24 ounces a day of cow's milk. Cow's milk not only contains little iron, but it can also decrease absorption of iron and irritate the intestinal lining, causing chronic blood loss. Other less common causes of iron deficiency include blood loss from the gastrointestinal tract due to gastritis, inflammation of the stomach, esophagitis, inflammation of the esophagus, ulcers in the stomach or bowel, hemorrhoids, angiodysplasia, leaky blood vessels similar to varicose veins in the gastrointestinal tract, infections such as diverticulitis, or tumors in the esophagus, stomach, small bowel, or colon, blood loss from chronic nosebleeds, blood loss from the kidneys or bladder, frequent blood donations, intravascular hemolysis, a condition in which red blood cells break down in the bloodstream, releasing iron that is then lost in the urine. This sometimes occurs in people who engage in vigorous exercise, particularly jogging. This can cause trauma to small blood vessels in the feet, so-called March hematuria. Intravascular hemolysis can also be seen in other conditions, including damaged heart valves or rare disorders such as thrombotic thrombocytopenia purpura, TTP, or diffuse intravascular hemolysis, DIC. What are the signs and symptoms of iron deficiency anemia? Symptoms of iron deficiency anemia are related to decreased oxygen delivery to the entire body and may include being pale or having yellow sallow skin, unexplained fatigue or lack of energy, shortness of breath or chest pain, especially with activity, unexplained generalized weakness, rapid heartbeat, pounding or whooshing in the ears, headache, especially with activity, craving for ice or clay, picophagia, sore or smooth tongue, brittle nails or hair loss. How is iron deficiency anemia diagnosed? Iron deficiency anemia is diagnosed by blood tests that should include a complete blood count, CBC. Additional tests may be ordered to evaluate the levels of serum ferritin, iron, total iron binding capacity, and/or transferrin. In an individual who is anemic from iron deficiency, these tests usually show the following results: low hemoglobin, Hg, and hematocrit, HCT, low mean cellular volume, MCV, low ferritin, low serum iron, Fe, high transferrin or total iron binding capacity, TIBC, low iron saturation. The peripheral smear or blood slide may show small oval-shaped cells with pale centers. In severe iron deficiency, the white blood count, WBC, may be low and the platelet count may be high or low. What other tests will be done? If iron deficiency is diagnosed, your doctor will decide if other tests are necessary. Iron deficiency is common in menstruating and pregnant women, children, and others with a diet history of excessive cow's milk or low iron-containing foods. By talking with your doctor about your diet and medical history, your doctor may gain enough information to determine whether additional testing is needed. In patients such as men, postmenopausal women, or younger women with severe anemia, the doctor may recommend additional testing. These tests may include the following: testing for blood in the stool, fecal occult blood test, looking for abnormalities in the gastrointestinal tract, upper and lower endoscopy, looking into the stomach, esophagus, or colon with a tube, capsule enteroscopy, swallowing a tiny camera that takes images of the gastrointestinal tract, barium enema, barium swallow, or small bowel biopsy, testing the urine for blood or hemoglobin. In women with abnormal or increased menstrual blood losses, a gynecologic evaluation that may include a pelvic ultrasound or uterine biopsy. Sometimes it is difficult to diagnose the cause of iron deficiency, or your doctor may be concerned that there is a problem other than iron deficiency causing the anemia. These may include inherited blood disorders called thalassemia sin, which red blood cells also appear small and pale, hemoglobinopathies such as sickle cell disease but not sickle cell trait alone, or blood disorders.